Hi, everybody. Welcome. We've got a great program set for you this afternoon. I'm Jen Kovich-Bordnick, CEO of FHI, Executives for Health Innovation. Breaking in our new name here. It's wonderful to have everybody here today. While folks are signing in, we'll give them just a moment to log on. We'd love to see where you are signing in from. So if you want to jump into the chat box and tell us where you're logging in from around the country, we'd love to know where you are. See if anybody on the East Coast, West Coast, Midwest, got any global folks today, let us know. DC, welcome neighbor. Great to have you here. Phoenix, Indianapolis, San Francisco, wonderful. Lee Anthony, where are you logging in from this morning?
Newark, New Jersey.
All right, do we have any Jersey tri-state area folks for Lee Anthony today? Come on, let me see.
Me too.
Craig. All right, we got Raleigh, we got Pittsburgh. Nick, where are you logging in from this morning?
Concord, New Hampshire.
New Hampshire. Okay,
Yep.
Come on, let's see our New Englanders. All right, Rhode Island, close enough, Nick. All right, welcome Georgia, Seattle. It's great to have everybody here today. We have an incredible session. Delighted you can join us here today. We are talking about the news of the day that everybody's talking about, the workforce burnout that's going on right now, and a variety of reasons for that. We know, I think there was a recent survey that class did, a whole different reasons, a lot of chaos in the work environment, work getting done after hours, all kinds of administrative burdens, of course, psychological, mental, physical. It's just been a really rough 2 years for a lot of folks. And we're gonna be talking about that burnout today and how we can provide some relief and some great tools for doing that. So it's great to have everyone here today. We are hoping that you'll also join into the conversation. So we are anxious to see your comments in the chat box as we're talking today. Your questions are welcome as well in the Q&A area. So please feel free to pop those in there with us. Great to have you here today. And I do have my sidekick, my partner in crime, Emma Valinsky, on the line, who's managing the slides for us in the chat box. So Emma, we go to the next slide, get through our basics here. Great, thank you. So who are we? EHI, formerly known as eHealth Initiative, we are renamed now the Executives for Health Innovation, a catalyst for healthcare transformation. And how do we do that? We do that with all of you. Bringing together diverse stakeholders to talk about critical issues like the one we're going to talk about here today. Go to the next slide. And EHI is focused on 4 major issues this year: modernizing public health, health equity, virtual care, and privacy and security. And we're probably going to touch a little bit on all of these issues today as we go through our discussion. But we're very interested in what's happening out there in the private sector right now and who's got best practices to resolve and deal with these different challenges that we're all facing right now. So interested in getting you as engaged as possible in our current work. Go to the next slide. This is a list of the executives that we're working in right now. So if you see the logo for your organization up there, that's great news. It means you're a member of EHI. If you don't see the logo of your organization, but you'd like to get more involved in our research and advocacy and education efforts, I encourage you to reach out to me in the chat box, and we will get back to you on how you can belong and get more engaged. We are always looking for new executives and leaders around the industry to join in our work. So please reach out. And a couple of events on the horizon, really looking forward to having you join us. We've got a great session coming up March 9th, HIPAA for Dummies. That's led by our privacy expert, Alice Leiter. We have a great program coming up March 22nd on the interoperability rules. Is that going to change healthcare integration forever? We will see. We'll be talking about EHR usability and optimization solutions at the end of March. And we've got a slew of different member-only briefings and work groups coming up as well. So encourage you to visit us at ehidc.org and join us for those sessions. We also have a great program series right now looking at public health modernization and all the things that we've learned from the recent COVID pandemic, now hopefully an endemic. and how we are moving forward on that. So great sessions there. Please don't miss those as well. Next slide. And a big, big, big thank you to Craig and wellsheet for sponsoring and underwriting the program today. EHI is a very small nonprofit, and if it were not for the generosity of groups like wellsheet and others, we would not be able to run these exciting and really interesting discussions and conversations. So thank you for supporting this program. And I've got a really fun panel today. We had a prep call yesterday and it went much longer because this is just a really good group to talk with. So I think you're going to enjoy this today. We've got Nick LaRochelle, who's a medical director at Concord Hospital Emergency Department, Craig Lamoli, who's the CEO and founder of wellsheet, and Leanthony Matthews, who is a nurse and MBA, Director of Information Tech and Systems at Newark Beth Israel Medical Center. And a whole slew of acronyms there behind your name, Leanthony, which is really impressive. Next slide. I'll pull down the slides. I think we're just going to the Brady Bunch 4 faces here, so we can stop sharing there. Great. So welcome, guys. I'm just going to go by first names here, if that's okay with everybody. And I'd love to have just some perspective from each of you. As I mentioned at the top of the hour, you know, we've seen a lot of issues with workforce burnout, and let's just say with clinicians in general over really the last year. I think it's been the worst, but it'd be great to hear from each of you a little bit. First of all, just let folks know the environment that you work within, and then some of the things that you've noticed about that over the last year. And Nick, why don't we start with you? You're in the ED.
Sure. Yeah, so I'm an emergency medicine physician, and I am the medical director over 3 emergency departments in our transfer center. So coordinating flow between the hospitals. And we certainly, the pandemic has been very challenging, managing particularly the pandemic inside the hospital. So in our hospital system, we actually have had a lot of improvement recently in COVID numbers, but the COVID was an entry point for wellsheet for us, and certainly a great tool during the pandemic when we were managing about 40% of our admitted patients with COVID-19. So that's where our entry point, and we've learned a lot from that experience, and have kind of a path forward with wellsheet to expand to use in other areas as well. I can give a little bit dating back. We implemented Cerner in 2017. We had multiple systems that we brought together, which was great to have information in one place, but we realized that we really struggled with data visualization. So how we visualize the data, but also how do we pull the data that's pertinent out? And that's when our partnership with wellsheet began at that time. So. Great.
Leanthony, just give us a little bit of background on you and some of the challenges that you've been facing.
Sure. You know, I work with RWJ Barnabas here in New Jersey. It's the largest healthcare organization with, right now, we probably have 13 plus hospitals. But we were looking for a solution similar to the other scenario where, you know, we had Cerner, that was our electronic healthcare solution. And what we saw were providers were having a bunch of time needed to go through the chart to find those data points they needed to provide the most efficient quality care. So prep in the morning, for example, residents, physicians, you would spend 20, 30 minutes going to find certain critical data elements, which took you away from patient care. So we were looking for a solution that we could integrate into our Cerner application. And wellsheet, at the time, we worked with them when they first started, and they provided a solution that worked with Cerner, not separate from Cerner. It was integrated within Cerner. And it allowed the information to be pushed front facing for the clinician. So rather than go have to find it, it pulled it forward, and it was able to adapt to their needs. And that's where we found the added benefit of this application. And once providers saw it, they didn't want anything else. And that's where the benefit came.
Let me just, before I get to you, Craig, let me just jump back to Nick real quick. Nick, give me an example of maybe how you use some of this technology to improve the workflow. So, we know that clinicians are really overburdened, and the example that Lee Anthony gave there, but tell me how, you were able to resolve some of the workflow issues.
So I think when we implemented Cerner, we had clinicians counting the number of clicks it took them to access information in the chart and reporting it to us. And I think an example from the beginning of the pandemic, we had a panel of 40 patients in the hospital fairly quickly with COVID-19, but from a testing standpoint, we didn't have the ability, we didn't have rapid testing. And so every evening I would spend hours in the chart trying to determine if test results have returned. And so in mid-March, we started working with wellsheet, and within 2 weeks, we had a COVID list that would populate for us and with icons to tell us whether the COVID-19 test had resulted. And I would actually get a real-time alert. And from a hospital flow standpoint, we were able to move patients around to the appropriate negative pressure space. We were able to manage resources within the hospital because we had this kind of real-time data that was fed to us instead of us entering the chart to find that data. So it was really, that's kind of a more detailed example, but really impactful for us. And every time when we needed to adjust our testing platform, we worked with wellsheet, and within a few hours, we're often able to map that into the wellsheet program, so we didn't have any gap in the information we were receiving either.
Yeah. So Craig, what do you hear from your customers at different provider organizations around the country about what are some of their struggles in terms of workflow, and how are they dealing with that?
Yeah, absolutely. I think there has been really a big challenge with integrating new technologies into the clinical workflow to effectively support clinicians, especially in rapidly changing environments like the COVID-19 pandemic. And that's due to a number of factors. One is that oftentimes technologies are not built with the clinician as the core focus. They serve other masters. There's billing requirements, regulatory requirements, reporting requirements that those systems have to really focus on. And they let the focus shift away from the clinicians, and that results in increased administrative work and frustration for end users. Another challenge is the architecture of a lot of the incumbent technologies, the legacy EHR systems, where they're in making changes to support clinical workflow is very difficult. It requires a lot of effort and coordination across panels of physicians and consensus across committees. And with the way that the EHR systems tend to be designed, those updates are typically on one, maybe two a year, and they require a lot of time and investment from the health system, staff, IT staff to roll those updates out, which is increasingly challenging in an environment with labor shortages and a lot of difficulty really having the right people to handle those efforts. And so that results in these incremental improvements and innovation really being a challenge to get to those end users. And so with wellsheet as really a single unified cloud-based system that updates automatically for all of our users across the country as we introduce new improvements, there's this kind of renewed sense of clinicians feeling listened to. And technology actually responding to their needs and fitting directly into their workflow effectively that we've observed and has been beyond kind of transcending any of the individual features of what wellsheet does. That receptivity has been such a positive experience for clinicians, where they indicate they're interested in having something, and a few weeks later it's there for them. That's really powerful. And so it's been a pleasure working with great clinical leaders like Dr. La Rochelle and Lee Anthony to be able to facilitate that type of engagement with clinician and users.
Nick, I mean, you brought up a great example before about, how your clinicians were counting clicks. I'm actually curious how many clicks they counted, if you remember that. But talk a little bit about, so how were you able to reduce that? Did you reduce it from, was it, 50 clicks and now it's down to 30? And how did you do that? How hard was it to make those changes?
I think about if I'm in the acute care setting and we're waiting for test results, and a lot of what we're doing now is focused on, we have in the future less resources to do more. And how do we do time-based care inside the hospital? So how do we understand how long a patient needs to be in the hospital for a certain diagnosis? And how do we act on the results of the testing we're doing in real time? And for example, if we have a patient in observation status who's waiting a stress test, so a cardiac stress test, I could go into the chart 4 or 5 times, checking to see if the results have returned. And each of those times, that could be 20 to 30 clicks. Whereas with wellsheet, I can flag that and get a real-time alert when the result is back and act on that immediately. So the reduction could be from 20 to almost 0 for that patient for that purpose. So, yeah.
So you get an immediate alert anytime there's a result?
So if I came in the morning and I checked on my patient, I would flag the results that I want to receive a message for. So if the endpoint for that patient is a stress test, I would flag that result, and that result is in the system. I would get an alert, so I wouldn't need to re-enter that chart until I got my alert necessarily. So.
A great example.
Yeah.
Really good example. Lee Anthony, talk a little bit about are there different types of issues that you see with different types of clinicians? I know Nick's been talking a little bit about the ED. What do you see? You see across the whole provider environment. So what are you seeing as some of the other issues outside ED?
Sure. Some of the things, again, depending on the roles that I see, clinicians find very creative ways to utilize wellsheet. I've seen, for example, nurses, they have seen how the residents utilize it for handoff rounds. So because wellsheet provides part of their application where you can put your notes that are not part of the patient's record, but they're integrated within Cerner, you can put a note about something that's happening with a patient that you don't necessarily want as part of the medical record. So the nurses were able to, because they have full access to the wellsheet portion of the handoff, to look at some of the residents' information and other physicians, and that was a benefit for them. And they wanted a similar product more for the SBAR. So the need for the nurses is more the handoff functionality of wellsheet, that putting the information that we use the term here at North Beth Israel, make it matter for the patient, the things that make it matter. That you can put those little blurbs of information that you want to pass on for the SBAR rounds to the next clinician or next nurse that's coming on. So at least for the nursing, they really like that piece of it. Like, I want to put something, but I just don't necessarily want to put this in the chart or in a note. And vice versa, the charge nurse can run a report of all the SBARs of all the patients on a unit and see all that information, and they can pass that information to charge nurse handoff using wellsheet. So that's the nursing side. I've also had clinicians, like physicians who are outpatient. They like the fact that they have that information when the patient leaves the hospital. It still lives in wellsheet. They're able to have their own personal list of information that can carry over to the outpatient side. And again, that's integrated within Cerner. So I at least this iteration of wellsheet, you're able to follow your patient list even after the patient has left. And that's a benefit for them.
Great. And we're going to see what this looks like in just a minute or so. Nick, before we jump to that, Nick, I was hoping you could kind of share for folks just in general a little bit about, we've been talking about burnout, but talk a little bit more specifically about what's the connection between clinician burnout, this administrative workflow issue. I mean, some people might be wondering, why would somebody get burned out just because of clicks and
yeah, absolutely. So as a clinician, my focus is on kind of bedside. What can I do for the patient at the bedside? And I think the challenge sometimes in an electronic medical record is it can be stressful when you're trying to focus on what does the patient need at the bedside to translate that into the medical record in terms of how do I access information that will help me make a decision. Once I have the information, I'm able to make that decision for a plan of care, but really being able to pull out the pertinent information that's not clouded by the vast information that is in each medical record. I think that significantly reduces stress and helps to bring some clarity to the decision-making process when we're making like a plan of care for a patient, for example. So.
And I would encourage folks in the audience today, if you have similar examples that you want to share with us, please pop them there into the chat box so we can share those more broadly and get some responses here. Really interested in your feedback. Want to make this as engaging as possible. Craig, maybe show folks what this looks like a little bit at Nick's site and at Lee Anthony's site.
Absolutely, yeah, we can chat through that. So the first view I wanted to show here is really the core of what wellsheet does, and that's predicting what information is most relevant for a particular clinician to know about a particular patient, and presenting it in a really user-friendly, intuitive, contextual view. So you can see here the wellsheet view of, in this case, COPD. We have a couple hundred of these different views, and wellsheet anticipates which one is going to be most relevant to the end user and surfaces the right information in that context, both in terms of curated decision support on the left-hand side and predictive data displays on the right-hand side that track the relevant metrics over time for that particular patient and really pull out that salient key data for the physician so they don't have to hunt through the chart to find that information for that patient. And users can very easily modify this to make it their own. It's highly customizable by the end user, and it's really easy for them to adjust it to their needs. And that follows across all patients that they see in the future for that particular provider. So they can have their own COPD view to track over time. And we learn from that. So this is something that's constantly improving as clinicians engage with our system. I was actually hoping Nick could talk a little bit about how these types of clinical views help in maybe cardiac care, if that's a topic you could hit on.
Yeah, and just looking at this slide, Craig. So this is your view here is for COPD. So this could be a very medically complex patient, and what wellsheet does is pulls out information that's pertinent to decision making in real time. So what stage of COPD does this patient have? What medications are they on already? And have they had the necessary outpatient testing to understand what their treatment plan would be? Something we've worked on together that we're going to implement soon is we've created an observation unit where we've really reduced length of stay in the hospital, and a large population we see there are patients who are admitted with chest pain and require stress testing. And in working with Craig, he came to us and said, what are the things you care about when you look at the screen? And so each morning, and so that would be any prior testing, cardiac testing, the cardiac enzyme trend, and pertinent cardiac medications. So we're able to pull all of that out of the chart into one area, and creates a lot of clarity in decision making when we're able to do that. And again, from a burnout standpoint, reduces the number of clicks in the chart too.
Thank you. Yeah, and these clinical views apply for both inpatient and outpatient settings, but the timelines obviously are very different. You know, a matter of hours or days on the inpatient side, and months or years on the outpatient side in terms of these timeline views. But wellsheet also has really dedicated functionality for care team collaboration. Handoff was mentioned by Lee Anthony, and really the ability to coordinate care to support inpatient clinicians to more efficiently get access to the right information and be on the same page in delivering care to patients. So that's across a wide variety of features: smart alerts, discharge planning, team-based care coordination, flexibility across multiple roles, and serving nursing care managers as well as physicians. And we're seeing health systems report reductions in length of stay as a result of having access to this functionality and the benefits that it provides from an efficiency perspective across the patient's stay in the hospital. Just to call out a little bit more clearly how that looks and feels, you can see this is the handoff view for wellsheet. So you can see your list of patients that synchronizes with the list that's in Cerner. So those are always in sync. There's no need to manage a list in two places. And all of the key data for that set of patients pulled from the chart, if available automatically, like medications, but also kept up to date by the care team to really be on the same page about the care plan. So this really drives a lot of the value that Lee Anthony described for the nurses being on the same page as the residents and the attendings, and really everyone understanding the care plan so that the patient is receiving their care in an efficient way. All of these features are available whether you're within Cerner or Epic is another system that we work with, or on the go in mobile contexts. So that functionality can follow the clinician wherever they go, and can be easily accessed through our mobile applications, Corded.
Craig, one of the questions we have is actually that, couldn't you have this kind of clinical view in the primary EHR? So what's the reason to kind of have it separate?
Yeah, so the clinical views that wellsheet shows are a lot more dynamic than the EHR itself, which tends to be static from one patient to the next. So wellsheet really adapts the clinical view to the patient that you're seeing. And so we're able to pull together the most relevant content to show to that particular clinician, and combine that with functionality for clinical decision support for COPD, for example, like Dr. La Rochelle was mentioning, the handoff functionality side by side with these clinical views that highlight the key data elements. So all of that comes together into a really cohesive solution that fits into the EHR. So it's really not, it doesn't feel like something separate. It feels like a part of the existing system. So you really get a nice cohesive solution that adds functionality and simplifies the clinical workflow in a material way. That is also easy to install, easy to maintain, very, very low resource requirements. Whereas if you wanted to create clinical views in the EHR, there are ways of doing that, but it's much more manual, right? You have to have an IT team to come and build out these views, and wellsheet comes with so much functionality out of the box, so you can really avoid a lot of that customization effort, and ultimately have a better experience than you can get in just the EHR itself.
Great point. Great point. And then actually, Craig, while we have you, quick question. Would this look different across different instances of an EHR? So does it depend if you have Epic or Cerner?
It's a great question. No, it's the identical interface. All of the same functionality features are available within Epic, within Cerner. We've also been able to extend across multiple instances, multiple EHR instances, and provide a unified view of information. So for health systems that have both Epic and Cerner, for example, they can see patient information in a single place in a unified way. So that's also very powerful for larger health systems that, due to all the consolidation in the industry, oftentimes do have to manage multiple EHRs. But it's also a benefit to really be able to have a consistent look and feel, whether you're on one EHR or another, and a system that complements the EHR itself, but provides that familiar functionality. And RWJ Barnabas Health is actually in the process of converting from Allscripts and Cerner to Epic. That's a journey that they're on, and this is something that they can take with them when they make that transition.
So this looks like something that Nick would see. Is this, Nick, what you see on your phone or on your screen at work? Can
yes,
you talk
exactly.
us through this a little bit?
So the image on the very left is an example of a real-time alert that you would get. So that's a cardiac enzyme, and then COVID-19 respiratory PCR panel. So these are examples of things that I would go into the chart and check off that I would want to be notified when they return. So that's an example of an iPhone alert. In the middle, this is a patient list, example from the beginning of the pandemic. And we were able to pull in data on whether, based on orders in the chart, for what precautions the patient was on. And we're able to map those here, whether they were on a ventilator, and then their COVID-19 status. So whether they had a positive test, negative test, pending test, or second test sent. And then I think the other element here in the team notes section, you'll see Lee Anthony mentioned the communication component. And when we think about, I think this is important for a couple of reasons. When we think about adverse events, delays in care, there's often a communication component to those. And this allows multiple members of the care team to see what is going on with the patient and make additional notes outside of the medical record. The additional thing we did with this is we had our nurse navigation team from the outpatient offices work in that team notes section as soon as the patient entered the hospital to track what needs the patient would have outside of the hospital. So there's certainly an impact on that post-acute care period where we track readmissions to the hospital. I think a more granular example would be if I started someone on anticoagulation as they entered the hospital and they needed to follow up in an anticoagulation clinic, I could put that into the team notes section, and the nurse navigator would see that as the patient's in the hospital and would arrange that in a post-acute care setting. So really be able to wrap around the patient all the services they need and support to prevent a readmission or coordinate care on the outpatient side. And then on the right-hand side is an example of a risk stratification tool. This is the SOFA score. There's a heart score we use frequently. There's scoring for COPD. There's a lot of these scores then impact our patient care and our clinical decision making. So when we access these outside of the medical record right now, it's usually through a website that we click in to calculate things. So these tools are very useful to have built into wellsheet.
Anthony, is this pretty similar to what your folks look at?
Yes, absolutely. I mean, I think that's one of the benefits. It's kind of similar UI in terms of the phone, even though it's more compact versus there's a way you can view on the web. Two, when you're inside of Cerner, and it actually blurs the line. When you talk about wellsheet, people think of it as, oh, it's part of Cerner. But when you're sitting at a restaurant and you can pull out your phone and view the same information that you can within Cerner, it makes a big difference. But that's how you benefit from having access to this information. So it does look similar.
Great, and just some results in terms of the types of impact that wellsheet has had with health systems across the country. I mean, KLAS has done independent research talking to wellsheet users, and it's just a really drastic improvement in satisfaction that they experience having the solution. Same thing with Net Promoter Scores. The training is so lightweight, and it's just a very intuitive solution. So clinicians are able to pick it up very quickly and easily. We often see physicians who have just word of mouth heard about wellsheet and have been able to start using it and incorporate it into their workflow without any formal training, even because it's so straightforward and easy to use. And then from an implementation perspective, there was a question about the FHIR APIs, and wellsheet integrates in a very seamless way to the existing EHR systems using standard APIs. So it can be deployed in just a matter of weeks. There's very little effort that's required by the health system to actually roll this technology out because it's entirely integrated through standard APIs. So that's a big benefit and allows for health systems to take action and get results quickly. And then, as I mentioned, the ability to continue to get improvements and upgrades without having to put in effort really helps to ensure that the pace of innovation and improvement is vastly accelerated, and that responsiveness to user needs, as I mentioned, is really appreciated. So just wanted to call out some of those outcomes.
Super, great, really helpful to have those visuals. Let's talk a little bit about training and getting people to use these tools, because that can be a nightmare or a gift depending upon where you are. So, I mean, particularly during COVID and while there's so much chaos going on, how do you bring these things up and bring them live, and how do you deal with that in this environment? I don't know if Lee Anthony, you want to comment on that?
Yeah, I can briefly talk about that because, I was here when we first started wellsheet, and I've seen it used, during our COVID multiple influxes. A few things. One, the first users we show it are the residents that come in, those July residents. And it's probably also the first time they're seeing Cerner, but because it just brings a natural efficiency of pulling that information, they don't know any different. And to them, it's great. So they're still using Cerner, but that information pull at the beginning of the shift is great. That rounding and that natural flow reduces time in the chart. So then other clinicians start to see that and they want to know about it. And like Craig said, it's very simple. If you already know Cerner, and I'm using Cerner's example, but I know it also for Epic, because it's so efficient at pulling information. Once you show it, it's better on just pulling the information. So the training is minimal. We tag on maybe a good 20 minutes when we do the general Cerner training for the clinicians. And sometimes they don't want the training. We give them a PDF. And as well as there's training embedded within Cerner, just videos and things. And that's all it really takes, because you just need to know those basic things on the UI and how many ways you can access it. And it's just a quick turnaround. And, I do also support the help desk tickets, and I get very minimal calls because once they start using it, it's so intuitive. And then the last piece I'll add is anything that we need to add. For example, nurses wanted not only the S-bar, but for nurses, they wanted the efficiency to add their units templates. Certain units have very specific things they want in handoff. And wellsheet did not have it at the beginning. You'd have to type it in or paste it in. But it was a quick turnaround for wellsheet to put this templating feature in. So certain units like mother baby might have very specific things they want in their handoff from nurse to nurse. Now they can set their own templates, and everyone in the unit can use that specific template. And that was just a quick turnaround. That wasn't, if you went through Cerner, taking multiple updates, which might take a month to a year to get put in. That's where it helped. So.
Nick, how about at Concord, what was adoption like? Was it hard to get folks to use this?
I think any new technology adoption is always initially tough, but I think what the thing that we found is that our most reluctant users of the electronic health record at the beginning, when we showed them wellsheet, they were some of the most common users of the electronic record. So if they struggled with the introduction of Cerner, just because of finding information, the number of clicks, transitioning from a paper record, they were actually our most common users of wellsheet because it brought all that information, simplified that information, brought it to them in an organized fashion.
Great. Craig, you want to add anything?
The training in our experience, as I mentioned, it's a very intuitive tool, so it does not require a lot. However, we are, as an organization, are committed to really over supporting our users. And we really like to even be on site at the elbow with users as much as possible and make sure they're getting the most out of the tool. That's incredibly important to us. We have real-time responses to questions. We allow users to send directly to our organization and can address any questions or feedback that we get from end users. And those often result in us incorporating that feedback into the product as well. So everyone benefits. It's really, for us, all part of the service we provide, not just the technology, but also the ability to actually incorporate the technology into the workflow for the end user and for the system at large. So that's a really important part of what we offer.
So Fred, talk a little bit about what's the difference between some of these solutions that are integrated into the EHR versus implemented. So what does that mean? What's the difference?
Yeah, so the large majority of technologies in the healthcare technology market to date are still based on traditional means of EHR integration. So the same types of HL7 V2 interfaces have powered EHR integrations for decades. Only in the past 5 or so years have modern APIs been implemented by the major EHR vendors. And these APIs are incredibly improved in terms of the amount of time that it takes to deploy new technology, in terms of the amount of maintenance it takes from the health system, and the functionality that the technology can have. So one of the benefits of the APIs, in addition to a much decreased implementation timeline, is that wellsheet or any API integrated solution can actually exist directly within the EHR. So it's just a button within Cerner or Epic. There's no need to log in again. There's no need to re-identify the patient. It really feels like a feature within the native system. So that helps to make that transition to using a solution like wellsheet so much easier, because it's part of the existing system that clinicians are used to. So I think that's a big distinction across the way most technologies integrate and this API integration model.
So getting back to kind of the broader issue, guys, in terms of workforce burnout and burden and everything using this technology, I mean, what are some ways that you're seeing clinicians, nurses, and physicians really support each other through technology and just in general during this difficult time? Yeah.
From what I see, and again, I take it back to, when I worked at the bedside, in critical care, pediatric critical care, I would call it my brains, it would be everything on paper. And I would love to be work back to back, because I could just use my same note, just maybe make updates to it. That benefited me greatly, because for the most part, it was continuity of care. I had most of my information. I think this also goes for residents who rotate on and off. But the value of wellsheet, what it brings is one, it's not on paper anymore. And number two, it's available to other clinicians. So I might not be back the next day, but this format will go to the next nurse who comes on, and they won't have to write everything down again. I've seen sheets on paper, and when they're done at the end of the shift, they go in the trash. So wellsheet, it supports this workflow that does reduce time because, again, the information is there. It's electronic. Again, I have to mention, it's not part of the patient record, but that information is critical for that next clinician to efficiently get handoff report, for the charge nurses to have access to that same information. And I'm using nursing as an example, but that reduces, that improves the amount of time they're with the patient and doing those checks and things like that, versus writing everything on a piece of paper, which then goes in the not in the trash, in the shredder. And so that's the value, that's the time added. And those secondary benefits of, oh, the resident can see what the nurse wrote in their handoff tool. The nurse can see what the resident wrote or the hospitalist. And that's where you get added benefit and reduction and improvement in patient care.
Nick, what are some things that you're seeing in terms of nurses and physicians supporting each other right now to improve outcomes and reduce burden?
Yeah, I think the communication tool that Lee Anthony is talking about is really powerful. I also think if we think about when you're caring for a group of patients, so if I visit my first patient and I know they need an MRI, they're going to get an MRI that morning, I have still in my head have to remember I need to check for when that MRI is back. And that takes up space in my head when I'm trying to make other decisions. But if I have an alert that's going to come to me, I can move on. I can focus on the decision for the next patient. So I think when you think about that over the course of a day and multiple days in a row, that certainly contributes to burnout when we're thinking about making decisions in the clinical setting. Everything that needs to be communicated to different individuals, different shifts, that having that information centralized with a communication tool as well, knowing that information is fed to me and I don't have to pull it from the chart, is, I think, really, really powerful.
Yeah, thank you. And I do want to also take a moment to address the racial equity question in the Q&A. The first hospital that we went live with wellsheet was Newark Beth Israel, which is where Lee Anthony is the director of IT, and he's been the application owner for wellsheet at RWJ Barnabas Health since the beginning. And we actually spent many days in the hospital speaking with very racially diverse end users about what their needs were and how we can support them, and really ensured that this tool was built and designed with their needs in mind, and ensured that it positively benefited the population that they served. In Newark, as one of the most racially diverse cities in the country. And so that was the inception, really, of the solution in those settings. And so I think that's something that we've always carried with us. And we're really excited about opportunities in the future. We're continuing to expand. We've talked a lot about inpatient use cases today, but we're expanding through a partnership with Alliance Chicago to federally qualified health centers across the country, and bringing this solution to providers who are mostly serving patients, communities, underserved communities across the country. And that's something that we're incredibly passionate about, and it is a huge focus for us as an organization. So I appreciate the question about that, and definitely the focus that we have as an organization on providing relief and support to physicians, clinicians who are in those communities is a key for us as an organization.
And I think Carissa, thanks, has put in the chat box a couple of different articles around implicit bias, which is great, a really wonderful resource. This is a really tough issue, and I don't know that any technology tool is going to be able to prevent implicit bias. I think it's a really broad issue, but great. Thank you for putting that helpful information in there, Chris. I really appreciate it. We've got just a couple of minutes left, and I do want to make sure that we give everybody a chance to kind of wrap up. If there are any other questions, please stick them in the chat box. Craig, you've been busy because we had a lot of questions, and I think you answered many of them in writing, which is great. We'll send those out to everybody. But this has been a really useful session today. And I guess what I'd love to do is just kind of go around and have each of you share maybe 1 or 2 points in terms of this tool and this technology. You know, what would you like people to take home with them? If you could, people would take home kind of 2 key points around how to use this technology to reduce burden. What would be some 2 things you'd want them to remember and take home with them? Why don't we give everybody a chance to think about that for 10 seconds. And while you're doing that, we do have one other question in here. What kind of data or ROI have you used for your hospital leadership or the decision makers to get their buy-in for this on top of Epic? And that's actually a really good question, because I think getting internal support to get people to go in all in on a tool like this is hard. Lee Anthony, you're in IT, so I'm wondering if you were part of that decision and pulling that together at all, if you could share your experience.
Yeah, we, again, we initially implemented wellsheet. So those are some of the questions. We're able to look at even the click count for physicians, but we also know their time in the chart. So though we measured pre and post, and I know Craig has the data, but that was part of the way we were able to get buy-in to roll this out to additional hospitals outside of Newark and Cooperman, Barnabas hospitals where we started, because we were able to show a reduction of time of the clinician in the electronic medical record. I mean, that's what it comes down to. And that's more time with the patient, and that has a value. So we were able to show that. That's how we got a buy-in.
So reach out to Lee Anthony if you're looking for some data. Rajan, I would encourage you to do that. And I'm actually going to let Lee Anthony and Nick and Craig, if you guys want to, feel free to stick your emails in the chat box there so people can reach out to you. We will also be sending out sources and information to folks who are interested, along with a link to the session today. And I'm going to go around and give each of you guys just a few moments to share kind of your 1 or 2 takeaways you would like folks to take home with them. And there is also 1A, my partner in crime here, has put a link in here to SurveyMonkey to let us know what you thought of the session today. 1A, if you don't mind sticking that in one more time, because I think it's gone up to the top of the chat box. That would be great. We'd love your feedback. So Nick, what are 2 things people should take home with them today in terms of how to use this technology to reduce burden?
I think the first thing is data visualization in the context in which we visualize that is really important. And I think the second thing we've talked about a lot today too is communication. And as we build systems in hospital systems where we have more team members collaborating on care for individual patients, I think the ability to communicate and adjust the tool to individual areas is very important. And I also think, as a third thing, that the ability, so wellsheet has allowed clinicians to bring to them what they would expect in an efficient tool, and able to really adapt the tool to them, which I think is on the beds, when you're at the bedside, that's extremely important.
Great. Lee Anthony, you're up. What are 2 things to take home?
The 2 things are, one, with any technology, the key thing is it starts with the people. and making sure you have users that are engaged. And then the processes, before you implement any technology, you have to have these protocols in place, what the expectations are. Doesn't matter what you're using. The technology is just an added benefit. So, wellsheet or, any technology, the benefits that it brings are built on those other ones. So, for example, residents, they had a process. They were, the people, the process they had, and wellsheet just gave added benefits. So that's just one piece. If you're looking to implement that comes from leadership, supporting you with your processes, and then, hey, there's this technology. And so to me, just keep that in the back of your mind. It's not a panacea. It's not going to solve everything. You got to and you got to have processes in place. So that piece. And I guess the other piece is just that the ease of implementation of this, because of the API, the FHIR HL7 technology, it's agnostic to the EHR. So Cerner Epic, we were able to implement it very quickly with minimal support needed from our team. And because of those HL7 standards that Cerner has met and wellsheet links to. So that had added benefit and just made our life easier. So that's my takeaway.
Great, excellent. And Craig, you get the last 60 seconds.
Awesome. Yeah, no, Lee Anthony referenced the greater than 40% reduction amount of time that physicians have to spend in the electronic health record that we were able to show at RWJ-Barnabas Health. And that's incredibly meaningful time back for clinicians to spend more time with patients. And that's why we do what we do. I think another data point, we have multiple thousand clinicians, physicians across the RWJ-Barnabas Health system that opt in to use wellsheet because it saves them time for no other reason. It makes their lives easier. And I think that is tremendous evidence that this is a tool that really reduces the burden for clinicians. Across 7 hospitals used to treat over 400,000 patients across the system. So the impact, I think, is really clear in that usage.
Great, excellent. Well, gentlemen, thank you so much for the discussion this afternoon. Nick, Craig, Lee Anthony, it's been a great hour. Hope everybody's enjoyed the discussion. We will be following up. 1A will be sending out some information every day tomorrow. Feel free to respond to the survey. Everybody have a wonderful afternoon, and we will see you back here in a week. Thank you.
Thank you.
Bye,
Thanks so much.
guys.
Take care.